Madam President, it's no secret that in parts of Texas and in cities across the country, COVID-19 cases and hospitalizations are on the rise. Dr. Angela Clendenin is an epidemiologist at Texas A&M University's School of Public Health, and she attributes this increase to what she calls pandemic fatigue. After months of vigorous hand washing and mask wearing, it seems that people are becoming less and less vigilant. She said if we continue in the behaviors that we're behaving in right now without regulatory intervention, we're going to continue in the direction we're headed. Well, I guess that's one way of saying if we don't shape up, the present spread of the virus will continue with perhaps, in some instances, dangerous, even fatal consequences. That's a path we should not head down, and one that will put an even greater strain on our healthcare workers. I guess as I think about it, there are two ways to approach this pandemic. One is to leave it to government to tell us what we can and cannot do, to engage in more and more lockdowns and deprivation of our individual liberty, or we can take personal responsibility. Speaking for myself, and I hope others, I hope the personal responsibility route is the one we will take. From staffing shortages due to the coronavirus exposure to short supplies of personal protective equipment to a lack of critical equipment like ventilators, our frontline healthcare workers have carried on this fight in the face of tremendous challenges. Now, with cases climbing in parts of my state and around the country, these heroes are in dire need of another line of defense, and the public, meaning Congress, on their behalf, has the power to provide that help. Through the same simple steps we've heard about since the beginning of the pandemic, we can stop, or at least dramatically slow, the transmission of COVID-19. Again, it gets back to the basics we've all been taught, and I think more or less most of us have been employing: washing your hands, wearing a mask, practice social distancing, and don't let pandemic fatigue win. We need to all remain vigilant and committed to these basic practices until the experts tell us that COVID-19 is no longer a threat, likely a point after which the vaccine has been widely deployed. And none of us know exactly when that might happen, but we have been getting some great news this last week or so about scientific developments that have been funded by the efforts that we in Congress have taken together on a bipartisan basis. On Friday in my state, the governor announced that the Department of Health and Human Services will distribute a new COVID-19 therapy to hospitals across the state as early as this week. The antibody treatment is produced by Eli Lilly and will be critical in reducing hospitalizations. It's meant for those who are known to be at a higher risk of developing severe symptoms, like the elderly or those with underlying chronic illnesses. For those who are diagnosed with COVID-19, this drug may be effective in preventing the onset of severe symptoms. The antibody treatment has received emergency use authorization from the Food and Drug Administration last week, and I'm hopeful it will help stop, or at least slow dramatically, the alarming rise in hospitalizations that we've seen across parts of my state. So far, about 80,000 doses are ready for distribution nationwide, and we should have that up to 1 million doses a day by the end of the year. While the quantity is limited at this point, every single dose could mean a life saved. This alone is cause for hope. But the good news doesn't stop there. Last week, Pfizer announced its COVID-19 vaccine has been more than 90% effective in clinical trials. And just this morning, Moderna announced its vaccine candidate is nearly 95% effective. Just incredible results. This is exactly why we have invested billions of dollars in developing these life-saving drugs earlier this year. The funding that we have appropriated has supported not only research and development, but manufacturing of vaccines and therapeutics. We wanted to be sure that distribution could begin as soon as these drugs were approved as safe and effective, and that's exactly the direction we're headed in. We're on track to have tens of millions of doses of vaccine available by the end of the year, likely from at least 2 different drug makers. This historic investment has led to historic progress, and I could not be more proud of the men and women who have made this possible. I'm incredibly grateful to the healthcare workers who are continuing to fight this serious infection on the front lines. And I want to thank the researchers and scientists and thousands of volunteers who are supporting the development of vaccines and therapeutics. Beyond the physical toll this virus has taken, it's also having a profound impact on this country's mental health. This pandemic has brought on a range of new stressors, including isolation, financial struggles, health anxiety, and the stress of teaching children from home. In a Kaiser Family Foundation poll in March, roughly 1/3 of adults reported that their mental health was negatively affected by pandemic-related stresses. By July, that number has risen to more than half of the adults in the United States. As we continue to discuss what future coronavirus legislation will look like, we must not ignore the mental health impact. I've spoken at length about the need to support community mental health centers and community behavioral health organizations, which are vital mental health providers across much of my state and across the nation. These providers are a critical source of care and support for those battling mental health and substance abuse disorders, and the need for their services has only risen during the pandemic. The one group that's too often ignored in conversations about mental health care are those transitioning from the criminal justice system as well. More than half of those in the criminal justice system have experienced a mental health issue, and our criminal justice system is ill-suited to provide the sort of treatment and support that they need. But even when these individuals do receive treatment while incarcerated, they're rarely given the tools they need to succeed upon release. Approximately 80% of these people are uninsured after being released, making it nearly impossible to continue mental health treatment. Earlier this year, Senator Blumenthal, the senator from Connecticut, and I introduced the Crisis Stabilization and Community Reentry Act to support those who have become part of the criminal justice system and provide a stable source of treatment for them after they leave incarceration. Most prisoners who are receiving treatment for a mental health or substance disorder are released without a plan to keep up with their regime. This leads to higher recidivism rates, which could be avoided. It also means that law enforcement is too often left to be the first responder to a mental health crisis, which can escalate those scenarios and put both the officers and the individual at risk. Our bill creates grants to connect law enforcement officials to state, federal, and local resources to help individuals who are either engaged in the criminal justice system or being released from prison to get access to the support that they need. These grants connect those services to make sure that people suffering an acute episode can access treatment without the risk of unnecessary incarceration. Many times these people need help. They don't need to go back to jail. It has the ability to strengthen our community-based crisis response, reduce suicides during incarceration, and close the revolving door that leads people back to prison. I hope the Senate can pass this legislation soon and that our colleagues in the House will follow suit. With the ongoing mental health challenges brought on by COVID-19, there could not be a more critical time to strengthen our nation's mental health resources.